Conflicting views about ME/CFS have riven the medical community for 70 years. While the World Health Organization recognises ME/CFS as a physical disease, some influential psychiatrists and their colleagues developed and promoted graded exercise therapy, GET, and cognitive behaviour therapy, CBT, as curative treatments. The cognitive behavioural model of ME/CFS, as maintained by faulty illness beliefs and behaviours leading to reversible deconditioning, is rooted in bad science, but it has pervaded the UK healthcare system for the last 20 years. This has had a massively damaging impact on patient care and biomedical research funding. The revised NICE Guideline 2021 encourages safer management of the disease and attempts to enable more reliable and earlier diagnosis of ME/CFS.
One of the things that most concerns me is the self-perpetuating nature of bad science and the way that the most vulnerable members of our society, who should be the people we serve as scientists, are actually left by the wayside in order to preserve the reputations or status of the elite scientists and the people who are, on the one hand, promoting high standards, but on the other hand, operating in very self-serving ways.
There is currently no cure, and many with the condition experience inadequate care and support. But there are an estimated 250,000 people in the UK suffering from ME, and currently we are letting these people down.
Many primary care professionals receive minimal training on ME and are therefore occasionally prone to holding stigmatised, misinformed opinions about the illness.
Most doctors don't know what ME/CFS is, and 40% of doctors don't actually believe it's a real condition.
A lot of doctors make that mistake of not recognising that there is a specific illness, a specific physiological abnormality, if you like.
Many doctors believe that it's just tired all the time, people being fatigued all the time, and that is not the case. This is a multi-system disease with a lot of different symptoms. And fatigue, as many doctors understand it, is not really what we're talking about. It's a misnomer.
ME is classified as a neurological disease by the WHO. But I would say there are abnormalities not only in the central nervous and autonomic nervous systems, but also in the immune system and the metabolism of people affected, in particularly energy metabolism.
These patients have an inability to create energy for physical and mental activities that they want to do.
On average, people with ME/CFS have lower quality of life compared to people with multiple sclerosis, rheumatoid arthritis, cancer or depression.
The pain was immense. There would be days when I could barely move. Turning in bed was painful. Even having someone walking around in the room, the rustling would be too much noise for me and too much sensory input. I couldn't concentrate. I couldn't hold a phone to have a conversation by phone. I couldn't even work out how to answer my phone when it rang.
We want people with this illness to get an early and accurate diagnosis. Sadly, this isn't happening at present.
Unfortunately, there is no biomarker for disease. There's no diagnostic test that will confirm the diagnosis, and the routine tests that are usually carried out will come back within the normal levels.
Around about 40% of people with an initial diagnosis of ME/CFS do turn out to have a completely different condition.
Many symptoms of ME/CFS occur in other conditions, leading to high levels of misdiagnosis. But crucially, in ME/CFS, there is an abnormal response to even minor physical and cognitive exertion. This causes a distinctive, delayed, post-exertional exacerbation or worsening of symptoms, postexertional malaise or PEM, with an abnormally slow recovery time. PEM is totally different from the usual aches and pains and fatigue after exertion often experienced by healthy people and those with other conditions. It is now recognised as essential for making a diagnosis of ME/CFS in conjunction with other key symptoms.
Postexertional malaise is a primary symptom of ME/CFS. It consists of decreased function and an exacerbation of symptoms, usually following a physical event, but it can also follow a cognitive or mental event, and even an emotional event.
It can literally be just concentrating for an hour on something can be enough to trigger it. Likewise, if I just walked a couple of 100 yards, to begin with, that can often start with headaches or a sore throat coming on, feeling like I'm getting flu-like or coming down with something. And then a couple of days later, it really hits me and I literally can't get out of bed and I feel as though I'm concussed, I can't concentrate, and my level of functioning has to be taken down a couple of notches.
Postexertional malaise, it involves a number of facets, and one of those is a reduced capacity to function or to do work or to generate energy. And I'm sure there are no physicians out there that would willingly hurt their patients. But recommended graded exercise can be very, very dangerous.
NICE assessed the research evidence for GET and CBT as treatments for ME/CFS and found it to be of very low or low quality. In line with the Centers for Disease Control in the US, the revised NICE guideline now emphasises the dangers of GET and CBT, the treatments it previously recommended for patients, stating, "Do not offer people with ME/CFS any therapy based on physical activity or exercise as a cure for ME/CFS. Physical activity or exercise programs that are based on deconditioning and exercise avoidance theories as perpetuating ME/CFS." The significance of ensuring that people remain within their energy limits when undertaking activity of any kind is also highlighted. The rationale for using GET and CBT as treatments is provided by the cognitive behavioural model of ME/CFS. This model is harmful because it ignores the biological abnormalities of the disease and the cardinal symptom, an exacerbation or worsening of symptoms after any kind of exertion. Patients who keep trying to push themselves or whose life conditions and environment are too demanding can deteriorate badly.
The recommendation of graded exercise has caused untold physical damage to thousands of people. In fact, a 2018 survey found that 89% of ME sufferers experienced worsened symptoms after increasing activity. Now, if graded exercise were a drug, it would have lost its licence.
It's a huge paradigm shift for anyone to understand. In many illnesses, exercise therapy, aerobic conditioning is very beneficial. In ME/CFS, it isn't, and it in fact exacerbates the illness.
When I first experienced this fatigue, I tried to push through it, and it just gets worse and worse and worse, and then would last much longer, and I would have to rest for so much longer. And I've never experienced anything like it.
Patients or organisations knew that some people were getting worse, but it wasn't really being reported. So I sort of collated the data, and thousands of people have been made worse. 51% on average have been made worse by graded exercise therapy, and people shouldn't be coerced, because it's unfortunate. People can be coerced in all sorts of situations to exercise, and that really shouldn't be allowed.
Once ME/CFS was framed as a psychosocial condition, patients were dismissed as unreliable witnesses who paid too much attention to their symptoms, spurned as malingerers, and were even demonised by the media. This has thwarted biomedical research and funding for decades, creating a vicious cycle of ignorance, harm, and neglect. Early management of ME/CFS appears to be crucial, but many young people had no say, no choice in their treatment, and were made severely ill for decades. The cognitive behavioural model of ME/CFS, which has been dominant in the NHS, has harmed many thousands of patients and their families. The NICE Guideline 2021 states, Recognise that people with ME/CFS may have experienced prejudice and disbelief and could feel stigmatised by people, including family, friends, health and social care professionals and teachers, who do not understand their illness. Take into account the impact this may have on a child, young person or adult with ME/CFS. That people with ME/CFS may have lost trust in health and social care services and be hesitant about involving them.